David.
Hello.
Hi there, how is he?
Thank you.
Dr. Osborne. How are you today?
Thank you.
Thank you. I'm fine, thank you very much for asking. So we're here just to find out a bit more about you. Now that you've applied for medicine, why?
So it's like I've seen a lot of medicine in the past. My parents are doctors, so
Okay.
like I've seen a lot of medicine. It seems like something I'd be really interested in doing. I like science at school, so it's like science and medicine seems really interesting, worthwhile, kind of application to science.
Okay, so what kind of medicine do you do?
So I mean, my work experience, I spent a week at GP, and I spent a week in a hospital like in clinics.
Mm-hmm. Okay.
Hospital.
In clinics, and what did you see specifically?
We things like there's like some patients like there's the neurology. So there's patients with a lot of like Parkinson's disease and like motor neuron disease and that's like neurological problems. Some patients with like sort of facial problems and that sort of thing. So I saw a lot of that sort of thing. That was really interesting.
Okay. So yeah, you applied for a course for medicine. Why not other courses? I mean, why not nursing?
I just feel that so like doctors a bit more. It's a more interesting job. Sort of seem to make more of the decisions in hospital. It's I think it's so yeah. I just keen to be a bit more kind of more involved, really. I think.
Okay. Do you not think nurses are involved?
Although they're definitely involved. I mean, nurses are important. I just think that doctors, it's a bit more interesting. They do sort of more in hospital.
Do they do more?
So, I mean, like, doctors make a lot of the decisions, and it just seems as though it'd be a more interesting job.
Okay, fine. So why particularly more interesting? Just not understanding.
So I'm quite really interested in science, and
But why didn't you be a scientist instead then?
I think that I think for medicine it seems like it's like an interesting application. I enjoy my work experience. I've seen lots of things in medicine. I think it's sort of like really can really help people. It's something I want to do.
Okay, fine. Let's move on. So I was looking through your personal statement and see you do a bit of music. Just tell me a bit more about that.
Yeah. So I sing in some choirs and perform in some orchestras. So quite a lot. I perform a few times a week. Perform quite a lot, and I've been doing that for a while. So we perform around the UK, a lot of different cathedrals. I sometimes go abroad, so it's really interesting. And I've been with my current choir for sort of 4.5 years now. I perform some really interesting music, been to some really interesting places. Really enjoy just kind of pace learning. So we've learned go through the repertoire really quickly. So we learn lots of new pieces, perform in interesting places. It's something that I've really enjoyed.
Okay, what have we learned from it?
So things like I've learned a lot about sort of working in a team, because when you're performing in a music group, it's a lot about teamwork. And I've learned about, but of course, with all the music stills themselves, so like, and you can learn about.
Okay, fine. So tell me about a situation when you showed good communication skills.
So, for instance, I was when I did Duke of Edinburgh, for example, so I did Duke of Edinburgh Gold.
Mm-hmm.
So we had a few days expedition in the hills. It was out in Surrey, so it was bad weather there. It was really wet, and it required someone to really organise the team to really get everyone motivated, get everyone's morale up, because some people were struggling with fitness and struggling with there was the wet.
Highest communication skills, not leadership.
Right. So like, I guess maybe a bit more. I guess some of the I mean, in Duke of Edinburgh as well. But for instance, when I for my sort of skill for that, I did a first aid course, and then with first aid, you have to be really clear about expressing what you sort of need to do. Especially if you're going to help someone, you need to let them know, very clearly sort of who you are, what the role is that you're doing, why you're there. You need to be able to get information from them about what's happening clearly. So I think that's the time when communication skills are really important.
Okay, so anything specific? Any specific scenarios?
So when I was training in that, there was one time actually I was just in town normally, and someone had actually fallen down some steps and injured their leg. Mm-hmm. So I was really nearby at the time.
Mm-hmm.
With the first aid background, obviously I wanted to help. Mm-hmm. So just had to sort of go and sort of speak to them to work out what had happened and work out. Needed someone with good communication to ask them and work out what's happened to them and to organise the situation. So in the end, we called an ambulance.
Okay, fine. Can I? Sorry. This thing is driving me insane. I want to focus on your background. I mean, you said that you want to go into medicine, but do you know why the disadvantage, or what the sorry, start again. Absolutely, communication skills are quite important, and it's one of the skills you need. What other skills do you think are quite important for a doctor?
So the communication, I think, the knowledge is obviously really important. Having got the right knowledge, being able to apply the knowledge, and being able to work in a team, because obviously the different doctors, and sometimes when a patient has different problems, you need to sort of be seeing different doctors at the same time, doctors to talk to each other, to make sure they sort of all understand the same.
So do you think it's more important for a doctor to have good communication skills or to have good knowledge?
I think knowledge, because without the knowledge you couldn't be a safe doctor, and without the communication skills you wouldn't be a good doctor, but you'd at least be safer if you knew the right things. I think they're both important, but I think probably the knowledge is probably a little bit more important, a bit more dangerous to not have it.
Okay, fair comment. So, obviously you do a lot of stuff in your spare time. What do you think? What do you think you'll learn from it? Do you think you'll be able to use these skills when you're a doctor?
I think so. So things like I think just like working, like time management, for instance, doctors are really busy, and I've had sometimes quite busy rehearsal schedule, performance schedule. It's always important to be on time to things. It's important to make time to organise yourself. I think that skill will be really important. If I was doing a really busy job like being a doctor, so I think that side of it's important.
Absolutely. And what do you think are the bad sides of being a doctor? What do you think are the disadvantages of it?
Do you mean so like what's difficult, what the problems are?
Yeah.
I guess that's like if you're really busy, like working long hours. So like that's not ideal. And sometimes it could be stressful, or you could see like gruesome things or something like that, or something wouldn't like that. Or it could be emotionally difficult.
So how do you cope with emotional difficulty or stress?
Well, I like to make sure I'd like a work-life balance. So so if you have, so if work is stressful, but you can sort of, you can go away from work, and then when you can if away from work you've got something to do, like there's not a lot of music or something like that, then it's like a chance to refresh yourself and to mix with different people who aren't in the same position, and to just have a sort of a life away from it as well.
Okay, fine. Let's move on to a few scenarios that you may encounter if you become a junior doctor. So, imagine you've been given £1 million. You're also now the health minister. Congratulations. And you have £1 million surplus. And you can choose to spend that into an MRI machine. Are you aware what an MRI machine is?
Yeah. So they used it when I was doing with the neurology. They sometimes had scans, like MRI scans, so they thought.
Absolutely. So you can use it for an MRI machine, or you can use it to fund 50 liver transplants. Well, the caveat with that is these liver transplants are for people who've had alcohol-induced cirrhosis. Okay. What would you do? Who would you give it to?
I think, like you say, the liver transplants are it's like alcohol induced. I guess if someone, probably the MRI machine.
Okay, fine. Fine. So, and say you're a junior doctor in A&E, and you are on a busy night shift. Friday evening, a girl comes in. She's 16 years old. She's lost a lot of blood and urgently needs a blood transfusion. It transpires that she's also a Jehovah's Witness and refuses the transfusion. What do you do?
So she refused the transfusion. I think so. It's the patient's choice. So is 16 old enough to choose? So you can consent to treatment at 16. So if she wants to refuse the treatment, then she can refuse it as well. I mean, you obviously want to make sure that she understood. You need to be careful that she understood. That she knew it was serious. But if she decided that that's what she wanted to do, then I think you'd have to respect her choice.
Okay, fair enough. You're actually slightly wrong in the sense that at 16 you can consent to treatment, but you actually can't refuse it, so grey area. But what if it was 28? I mean, she could definitely refuse treatment then. Would you still respect her decision?
Well, I mean, I'd be very reluctant to. I'd want to really make sure that she understood, because it's only a fair decision. It's only a good decision if she understands what it means. If she just thinks it's something that's unimportant, and then if she thinks it's unimportant but she decides it, then it wouldn't be a fair decision. She needs to understand the consequences of the decision. But if she understood the consequences of the decision, then.
Okay, well, we'll leave it there. Thank you very much for your time. We'll be in touch with you in 2 weeks. All right. Thanks, David.
Thank you. Okay.
How'd you go?
Okay. I felt some of the questions were really difficult, things I wasn't really expecting.
Yeah.
So it took me a while to sort of think in my mind what was the best example of what you said, or what's the best thing to say. So sometimes, because I wasn't really expecting that type of questions, it took me a little bit of time to think. Really, I felt that was a little bit slow.
Okay, I want to pick up on what you just said. You weren't really expecting these type of questions. I mean, what kind of questions were you expecting?
I guess like expecting questions about why medicine, why would you volunteer?
Would you go?
Okay, yeah, that's true.
Yeah, they were slightly phrased slightly differently, but
and I guess I wasn't expecting questions like kind of asking so much about the work experience, because I sort of thought, well, I've written in my personal statement, so it says it there. Maybe I would need to talk about it here as well.
I mean, every question I asked you is a very fair question, I think, and yeah, they've all come up in previous interviews before. I kind of got the impression you actually haven't prepared as much as you probably think you have. Is that a fair comment?
I think so. In the sense, I felt before the interview, I felt I was probably well prepared.
Yeah.
But then in the interview, I just felt that I hadn't really kind of expected this. I hadn't really thought what I'd say to these types of questions.
Absolutely. I got the impression you knew what you wanted to say, but it just wasn't here. It was at the back of your head instead. And the only way you can improve with that is just practicing. It doesn't necessarily need to be with a mock interview. It could just be in front of a mirror. Just ask yourself the question, recite them. That doesn't mean you turn into a robot and start rehearsing them and learn them by rote, but it does mean you're able to answer them with fair fluency and confidence. Okay. In particular, there were certain things which I think you need to address. For example, the ethics question, when I asked you which one would you do, you gave me an answer straight away, which is I'd do the MRI machine. And meaning to really like I was in that mock interview would be, okay, fine, we'll move on. Yeah. Whereas you really need to pad out your answer and actually explain why you chose it. So you set the scenario, so you say, well, this will happen if we don't save, if we use the MRI, these 50 people may die. If we do the 50 liver transplants, the MRI machine will not be used. There are certain things you need to include, so you need to read up on the ethical principles. Buchon and Childress wrote them. They're very simple. You may have heard some of them already. Non-maleficence, beneficence, basically do no harm and do good is effectively what they're translated to. There are a few others. You may also want to read up on something called utilitarianism, which is the greater good for the greater amount of people.
How do you spell that?
Utilitarianism, U-T-I-L. Okay, yeah. In terms of the situational questions, I think, so when I asked for a time when you showed good communication skills, you gave me a time when you showed good leadership, which kind of was like, well, he's not answering my question. And I kind of think I'm alienate the interviewers. I was kind of like, today was, guy's not really engaged. He was just reciting stuff to me. And I think you just need to be a bit more specific with your answers. Alright. That's not to say it was terribly bad interview. I think you can just improve a lot with not that much work actually. How long have you gone to your interviews?
So I just got a letter through recently, my first interview in 3 weeks' time.
Okay, that's plenty of time to prepare. Make sure you go through the common questions, practice them properly, and then you'll be amazed at how much better that goes. I mean, I can guarantee if we run this in a week's time with you having prepared at least 2 hours a day, it'd be a lot better. Okay. Happy with that?
Yes.
Yes. Any questions?
I think it's just about the ethical ones. I guess I just found it difficult to kind of see to think of all the ideas, because I mean, to me it made sense at the time. So just to have, when to know whether you should sort of, whether it's one that you should answer quickly or one that you should go in a discussion sort of thing.
I think with anything where you're given a choice, you should always discuss both options, give arguments for and against for both options, and finally, if you're pushed to it, come to a conclusion. Alright.
Okay.
So,
okay, so always really trying to through it.
Yes.
Okay.
I mean, for something obvious like would you kill a patient, then it's quite obvious what the answer is going to be. But with that one, it's quite a complex ethical scenario. So yes, I'll take my time over it.
Okay.
The correct answer is not your answer. The correct answer is your explanation.
Okay. Okay. Thank you.
Yeah. Any other questions?
No, I don't think so.
Okay.
I've answered.
Okay. Well, David, look, it's been great speaking to you.
Thanks,
and I'll see you soon.